Health statistics for autistic people are shocking. Autistic people die on average much younger than non-autistic people. They are more vulnerable to a wide range of physical conditions, and they're much more prone to mental health issues. This is not, as you might think, because of health issues intrinsic to autism, but health inequality is more about how and when people access healthcare and the support that they receive. And it starts with the GP.
Going to a doctor's appointment can be stressful and worrying. They don't always know what's going to happen at those appointments, how they will be treated or spoken to.
We know that people who are neurodivergent just don't attend as much, and then that is a real disadvantage for physical and emotional health.
This film explores the barriers for autistic people around going to the GP.
Autism and GP surgeries.
Dr. Kath Fielder works at a GP surgery and a neurodevelopmental assessment centre. She's neurodivergent herself.
We know that neurodivergent people have difficulties with what's called interoception. So that's your ability to recognise the messages that you're getting from your own body. And that can also extend to something called alexithymia, which is where people aren't aware of their own emotions, or they can't separate them or give them a name.
Differences in interoception can be extreme. Kelly Marler is an occupational therapist in the US and a leading expert in interoception.
At one end of this range of awareness, people tell us that they have a muted inner experience, meaning that they might completely miss body signals. For example, one of my clients, he broke his femur and didn't realize it for 3 days. We also hear from other people a very opposite experience. One of my clients explained it as all of these sensations were just kind of happening and she didn't know what it all meant for her. Like one of those snow globes that you shake and the snow is just going everywhere.
Then there's the fear that GPs are going to laugh at you or think you're wasting their time.
I've never gone to the doctor feeling a bit down because I don't quite know whether I'm really down or down. Is this clinically relevant or not? And I didn't want to get laughed at or belittled by a doctor.
From a very young age, they experience sensory pain, like the world is too loud and people are telling them oh, it's not that loud, you're fine. Why take a chance to go to a medical setting and tell the stranger how your body is feeling, because you're at risk of this invalidation you've experienced your whole life.
Booking an appointment can be a challenge. Rob Henderson is a digital communications consultant who often works with the NHS.
There's a real barrier here in that people are being encouraged to use online consultations, to use the NHS app, but they're being asked to go through their GP websites, which are out of date, inaccessible, really, really difficult to use.
We asked people to send us their experiences.
The music played when I'm on hold overstimulates me and I often hang up before I can get through.
Your call is in a queue above 30.
As everyone knows, ringing up for an appointment isn't easy. But there's an added barrier for some autistic people who find it difficult or impossible to speak on the phone, especially when they're ill.
So when I'm perfectly well, I actually can use the phone quite easily. When I'm ill, I can't use the phone because I'm very overwhelmed and it's just too difficult at that time. Sometimes I do have to delay my contact with the GP until I know that I can cope with the call back.
You can arrange for someone to speak on your behalf with the agreement of the surgery, but receptionists and GPs don't always respect that.
My parents need to speak for me on the phone because I can't process a conversation without seeing the person at the other end. But one GP decided that was unacceptable and demanded to speak to me on the phone to verify I couldn't speak on the phone. I couldn't, so I had to wait 6 weeks for an in-person appointment, delaying my treatment.
When you get to the surgery, there's a whole obstacle course ahead of you or the person you support. That starts in the waiting room.
So often you'll have very bright strip lighting, very busy waiting room. Quite often the doctor's running late. So tolerating that environment in itself can be enough for a lot of people to actually leave.
Loud music, too, can cause sensory overwhelm. One man sent us this phone footage of the waiting room at his GP surgery. He found it unbearable.
We try to get there right at the time of the appointment, no earlier, because even just a couple of minutes delay for Cameron it feels to him like it's a very long time. He may headbang hard surfaces or slap or punch himself.
Surgery screens that flash up your name and a room number when it's your turn to go in for an appointment can make waiting rooms even more difficult.
You have to be constantly on high alert. Like, when is it going to change to me? You have to always be paying attention. So it keeps the stress levels really high. It introduces a lot of uncertainty as well. Like, where is room 4? And then once you get there, do I have to knock on the door? Do I go straight in? So I deliberately chose a GP surgery that doesn't do that.
Going face to face with the doctor is another step into the unknown. Do they know you're autistic? How will they communicate with you?
Some people call the patient in and they haven't even looked at the notes.
Often when we go for appointments, the doctors are running quite late, and sometimes they will try and rush you through the appointment a little bit. They haven't really read the information or understood about those difficulties that they may have beforehand, and it makes you feel like you're trying to get everything out very quickly.
And it's sometimes hard for neurodivergent people to communicate with the doctor in terms that both sides understand. This might just be a question of communication style.
People who are very direct and clear and factual and honest in their communication, which socially can often be misinterpreted as somebody being rude.
Or it could be about finding and processing the words in a stressful environment.
I get muddled with information and, they might give you instructions, how many tablets to take when, sort of thing. I need precise information.
I feel like I need 2 appointments, one to get the information and another to respond after processing it. I have agreed to things I didn't want to because I was too tired or put on the spot.
Some autistic people don't use words. If there are no communication aids in the surgery, their parents or carers will have to speak on their behalf.
Cameron expresses pain through self-injury. To, I think, the outside world, you would just see self-injuring and you would just see behavioral, and that's that. I can look at the same behaviors and go, oh no, he's in pain.
With both sides struggling to understand each other, an appointment can be a frustrating experience.
So many people don't feel able to say, what do you mean? And so you really run the risk of there being communication where no one's really been heard.
Some doctors dismiss symptoms as part of being autistic. This is called diagnostic overshadowing, and it can prevent GPs from taking illnesses seriously. A survey we conducted among autistic patients found that more than half have had their symptoms dismissed as autism or anxiety.
I don't feel the surgery truly understands autism. I've been told that the problem is just behavioural more times than I can count.
Professionals are very quick to dismiss autistic people or even their parents or carers and just say, it's just how it is. That can add so much frustration and a lot of heartbreak around an already difficult situation.
Dr. Carter Singh, MBE, a GP who campaigns against health inequalities, warns that diagnostic overshadowing can do real harm.
These kind of assumptions can be dangerous, and it can have a big impact on the quality of life of that patient, and also it can have an impact in directing the assessment, the diagnosis and the treatment down one avenue compared to another.
From a sensory point of view, physical examinations can be distressing for autistic patients.
Where you have to get undressed, and particularly intimate areas, no, don't like going at all. And I think there have been 1 or 2 times where I've felt it wasn't really done in a very sensitive way. So it felt like you were a piece of meat.
Another problem with examination is uncertainty about what's going to happen. Many autistic people need predictability to reduce their anxiety, but GPs don't always anticipate that.
For all patients, but particularly people who are neurodivergent, not knowing what somebody means or not knowing what's going to happen is really, really unsettling. So saying, oh, just pop up on the examining bed and I'll just examine you, what on earth does that mean? And sometimes people might not even say what they're going to do, they might just start doing it.
Finally, there's the question of whether your doctor understands autism or is willing to listen to those who do. Dr. Lucy Jane Davis is on the policy-making committee of the British Medical Association, which represents doctors across the UK. She is neurodivergent and has autistic children.
So in terms of looking after people, will I have an in-depth, detailed knowledge of autism? Well, I happen to have, but not everybody will.
But the patchiness in knowledge among GPs, and even interest, can be an issue.
From my personal and professional experience, there is a huge variation. Any GP you come across would have a really robust, decent understanding of the fundamentals of, say, cardiology. When it comes to neurodivergence, there is a greater difference in people's understanding or even belief.
This lack of understanding can mean poorer communication and care.
GPs always talk down to me and my family. As it happens, I have clinical training, but if I say I'm autistic, I might as well say I don't have a brain.
If they would just trust the people who live this, how much less harm would be done to these lives, because it's not just short term, it's not just physical health, it's the mental toll as well.
The impact of these barriers is that people either avoid going to the doctors or aren't understood when they get there. This can lead to preventable illness and emergencies.
If I really need to go, I'll go to the doctors, but I try to avoid it. I did have a heart problem. I had warning signals and symptoms for quite a few years, and it was only when my brother felt my pulse I went to the hospital. It resulted in me being in CCU for a week and then having a heart ablation. So there was something there that was going on, and I hadn't realised the gravity of it.
A particularly tragic case was that of Oliver McGowan, an autistic 18-year-old with learning disabilities. Oliver died a preventable death because medics didn't understand his autism or communicate effectively with him or his parents. His mother Paula explains.
Oliver's voice wasn't heard, he wasn't listened to, and us as Oliver's parents, as his advocates, we weren't listened to either. Oliver wasn't seen as a person. His disabilities were noticed first and foremost, and everything else was insignificant after that. There was a real failure to make reasonable adjustments, and as we know, reasonable adjustments are the law, actually.
Paula led a campaign for all health and care staff to be trained in autism and learning disability. It became law in 2022, and Oliver's training is being rolled out to the NHS staff.
Our GPs play a significant role. If our neurodivergent communities get that care and support and help and understanding from clinicians, they can prevent ending up in the acute settings or ending up in crisis.
On top of training, GP surgeries are legally obliged to make reasonable adjustments to ensure disabled people can access their services. Reasonable adjustments could include a quiet place to wait, a longer appointment, or a GP sending you a written summary of their advice.
Those are the sort of things that are such small changes, but they make a really, really big difference.
But our survey of autistic patients and parents found that only 8% had been offered reasonable adjustments by their surgery. More than half of patients didn't even know they existed.
The surgery as a whole hasn't ever offered any reasonable adjustments. It would make so much more sense, and it's not that difficult.
Offering reasonable adjustments is a legal duty under the Equality Act 2010. 1 in 4 people need adjustments for all kinds of disabilities. We rang GP surgeries in every NHS area in England to ask what adjustments they could make for an autistic adult. But some reception staff didn't appear to know what reasonable adjustments were.
I'm looking for a surgery to register with. I've got an adult son, he's autistic and needs support, so I was just wondering whether you made any adjustments for your autistic patients.
What that means, sorry.
Do you have alternative arrangements?
It depends. It's a doctor's decision.
I'm not sure. All I know is that what I would normally do is say, have a look at our website.
I've just put in a search for autism on your website and it says nothing found.
I wonder what it says on there. Nothing found about autism. I mean, what I would suggest, ChatGPT is amazing.
I don't know on top of my head, unfortunately, because I just book people in. Accommodations, like, when you say accommodations, what do you mean?
Other surgeries wouldn't give any information or said they didn't make any adjustments.
No, we don't have anything in place for anything like that.
No, we don't, I'm afraid. We would just deal with his needs, as and when required. I can't give you any more information than that.
Offering adjustments is so important to autistic people and their families, and it's unacceptable that surgeries aren't more proactive about it.
Those bits of support people need aren't extras. It's not doing more to make it easier for these people. It's doing more so it's not noticeably harder for people. You'd never expect someone who uses a wheelchair to just put up with it and come up some steps.
Of course, anyone who's tried to get a GP appointment knows the NHS is under huge pressure. It has its own barriers to overcome in order to provide the good practice it aims for.
So much work has been put from secondary care onto primary care, and it is extraordinarily difficult just trying to get through the volume every day.
The target is for doctors to see 25 patients a day in appointments that last 15 minutes. However, surgeries are so busy that it's not unusual for a GP to have to deal with 50 to 60 patients a day.
And that's very difficult because you've got a clash, haven't you, where you've got somebody who's got quite significant potential need for us to adapt. And actually, we may not have the brain space and the empathy to be able to cope with that.
It's a view shared by Dr. Kathy Peterson, clinical lead for mental health, neurodivergence and learning disability for the NHS in the North East and North Cumbria.
Implementing personalised care means that you have to spend a lot of time listening and making sure that you are providing the right reasonable adjustments. We are tasked with seeing as many patients as we can. That means that time is a premium for us.
The Royal College of GPs, which maintains professional standards, said it supports its members to deliver the best possible care for autistic patients. But it added,
above all, what GPs need is more time with their patients, especially those with complex health needs. While GPs and their teams are working hard to meet increasing patient need for general practice care, the number of GPs has not risen in step, meaning the time available for longer or more tailored consultations is often inadequate. Addressing this by investing in general practice and working to build the GP workforce will be essential to improving access and outcomes for all patients, including those who are autistic.
Another constraint is that GP surgeries are private businesses with their own computer systems and way of doing things. With more than 6,000 surgeries in England, that makes it difficult to enforce consistent standards.
I work across mostly 4 or 5 different practices, and each of them does things really, really differently.
A team of researchers at Liverpool University is now trialling a health passport for autistic people to help them advocate for themselves at the GP surgery. It's called the Autism Communication Tool, and patients fill in what adjustments they require, what their sensory and communication needs are, and what they want to discuss at the appointment.
There's a huge barrier in communication between neurodivergent patients and healthcare professionals, and we know that primary care is responsible for around about 90% of the NHS contacts, so it's a huge thing that needs to be addressed.
To overcome these barriers, the NHS is working on what it calls Reasonable Adjustments Digital Flag. People will be asked what adjustments they need, and these will be flagged on their records for all parts of the NHS to see, from GP receptionists to hospital consultants.
Our systems are not as autism accepting as we would like, and there's a number of things that we're doing, including the rollout of the Reasonable Adjustment Digital Flag, which is a way in our systems of acknowledging that someone might need a reasonable adjustment and of making those reasonable adjustments known in the system and personalised. It's not about what diagnosis you have, it's about what needs you might have. That work is being rolled out across North East North Cumbria and in fact England.
In the meantime, we believe there are simple changes that would make going to the doctors much easier for autistic people and their families. Surgery should adapt waiting rooms to be sensory friendly.
Having a space that you don't have the bright lights on, like you're not just walking into sensory overload. The music, yes, it's nice to have a little bit of background noise, but don't need like the top hits blaring at 100 decibels.
Why not let people wait where they're most comfortable?
In some restaurants you get a little vibrating pad that lights up or vibrates, something like that you can hold on to. So even if you wanted to sit in the car outside or you wanted to wait somewhere else, not in the building, you've still got the opportunity to have that, to be able to be called in when it's your time.
Give people information in advance of an appointment.
If you are going to your GP for the first time and you haven't been to that building before, you might not know how to get in. You might not know where the front door is, knowing where the reception desk is, what kind of seats there are in the reception area, how big it is. All of those things really, really help people with an expectation of this is what is going to happen, and they're not met with everything for the first time as it happens.
And potentially some videos that could be sent out in advance of an appointment to be able to see that, meet the doctors.
Doctors should be more curious about the patients and get to know them.
I always try to be more proactive in exploring who is this patient, and might even say something like, you know, we haven't met before. It's really important to me that this appointment goes as well as possible. Is there anything that you would like me to know before we start? Is there anything that you might find difficult?
Being treated as a person with maybe a medical problem rather than a medical problem. I want to feel cared for, you know, because you're vulnerable. You're feeling awful. You're probably having catastrophising thoughts about what's going on.
Remember that communication is a two-way process. Those of us who are autistic can have communication differences, but this is something for both sides to work around, not just the patient.
It's working out what's going to be the most successful way of communicating. Some people might need me to use a lot more simple language, spoken a lot more slowly, with a lot more pauses to allow for processing.
Even having, you know, visual aids on the walls, having a lanyard that just has a few basic, you know, like widget symbols.
Of course, communication includes body language too.
Someone might be smiling, but on the inside they are really suffering. So we have to be very aware of the fact that we express how our body feels in very different ways and believe what a person is telling you, no matter what they look like on the outside.
Doctors should explain what they're doing as they go.
If I ever need to do anything that involves touching, I'd say, now, usually I would touch your neck at this point. Is that okay with you?
The surgery should support with any follow-ups.
We know so many people struggle with working memory, with organisation. It's very easy to just say, oh, well, they didn't attend. But I think they need to say, would they think that for someone with dementia? And the answer is probably not. They would probably be more supportive.
Our survey found that 75% of people rarely see the same doctor. Surgery should aim for more consistency of care.
For people to see the same doctor who knows them well has such massive benefits, and it prevents so many unnecessary things from happening.
Some GP and surgery staff go out of their way to do all of this, but they don't get any extra time, funding or recognition for doing so. How much better it would be if good practice was embedded consistently across the NHS. For example, if all surgeries had to have a public policy document on accessibility. As for the NHS as an organisation, it needs to be far more proactive about offering support.
If the onus is on patients to go and ask for things all the time, then that's not providing them with a service that they need. It needs to be upfront, it needs to be accessible, it needs to be embedded all across general practice and not seen as an optional extra.
It would help neurodivergent doctors too, whose perspective is invaluable to the NHS.
One of the things that I think is really important is recognising that doctors are also neurodivergent. And actually, we sometimes need reasonable adjustments in the workplace. And that's really important. We are part of the community. We're not removed from the community.
In fact, raising the bar for neurodivergent people in the NHS would actually help everyone.
If one group benefits, it inevitably has a knock-on effect and other groups will benefit as well.
It's so important that people feel in charge of what's happening, because we have to remember it's a health service for patients. We're there for them, it's not the other way around.